Hello, everyone. I'm Dr. Lianov. I'm the president and founder of the Global Positive Health Institute, and this is our GPHI podcast series where we explore all things related to positive psychology, positive health, well-being, and much more. And today, I'm delighted to have with us as our guest, Christian van Nieuwerburgh, and he is professor of coaching and positive psychology at the Center for Positive Health Sciences at RCSI, which is a University of Medicine and Health Sciences. So that was a mouthful. Welcome, Christian.
Thank you so much, Liana. I'm so delighted to be here, and I'm so grateful for the work that you and your center is doing.
Oh, well, I'm delighted to be collaborating with you and delighted to chat a little bit. And let's just dive in and share with us what first got your attention about positive psychology and how important it is in our lives and for well-being.
That's a great question. I think on a personal front, I grew up in Lebanon in the Middle East. It was during, unsettled times, and we're seeing a lot of those now. So I do have a suspicion that I was always curious about how do we find hope? How do we find positivity, even in the midst of challenging circumstances? So I think that's been an ongoing curiosity of mine. But much more recently, I was working at the University of East London, and I ended up running the master's in coaching psychology at that university. And I was incredibly lucky that around the same time, there was a master's in applied positive psychology being run at the same university, and by one of the other guests you're going to have on this podcast, which is Professor Ilona Boniwell. And they were running a master's in applied positive psychology. I was running a master's in coaching psychology, and our focus was very much on how do we support people to bring about behavioral change. That was a very sharp focus. Along the corridor, there were students, animated students, bubbly students coming out of lectures around positive psychology. And honestly, Liana, that's when I first thought, wait, what are they studying over there? And then I was very lucky to be able to collaborate with Ilona and her colleagues. And we ended up integrating the two programs because my sense is, and I still believe this, that the science of positive psychology, the science of optimal functioning, is so important as a basis for the kind of coaching that I think makes the most positive differences.
Yeah, and that's wonderful. They are very integral and really health behavior change, and the underlying activities that we all do for flourishing and optimal functioning are very interconnected. So that was a smart move. Yes.
I'm very happy to say that it was driven by the students themselves. So we had students on the coaching psychology program who became curious. What are they studying about? Is it relevant to us? Don't we want to know about that? And Liana, what was interesting for me is that students in the Masters in Applied Positive Psychology program were similarly curious. They were saying, what are you all studying about over there? And I think it's been a beautiful integration between the coaching and positive psychology.
Yeah, wonderful. And we'll get back to talking a little bit more about your use of this professionally. But before that, I always like to ask our interviewees, our guests, how you use this in your personal life. How is it benefiting you? And what are some of your favorite tools?
Well, I love that question, Liana. And one of the most recent books that I edited is called From Surviving to Thriving. And it's a university student's guide. And as we were teaching this, as I was learning about it, I became so aware of what you said, the importance of us actually living by some of the things that we're learning. So I've got a myriad examples, Liana, and I know our time is limited, but I'll share a few. One is to, acknowledge and own my strengths. So one of my strengths is love of learning. I've always had that. And so I've really ensured that I have time for my own learning. I invest a lot of time in learning. I try to apply it to challenges in my life. I try to apply it when I'm developing new programs, but I know that it's good for me as well. So anytime I'm feeling a little bit flat or I need a little boost of energy, I just spend time learning. It could be by reading, watching a documentary, talking to somebody else. Ever since the first book I wrote individually, I've always co-authored since then. And the reason for the co-authoring is I just love learning. But on a more practical note, I'm the kind of person who gets very fidgety and restless if I'm in the same place for a long time. So little things like going outdoors during training days, let's say I'm teaching at university for a full day, all the breaks, I'm outside because I know that I like to be outside. I like to be in nature. And the final thing I'll say is, during the pandemic years, delivering on Zoom was, took away most of the pleasure and joy I get from the learning interactions. I just love doing it. I love being with people. And, during the breaks, I extended the breaks, probably for me more than the others, but I would extend the breaks. And during this time, I'd go out into my garden. And I know these are little things, but they're things that really boost my positivity. And the final thing, I think, is I spend a lot of time being intentional about the kind of energy I want to bring to certain interactions, including this podcast we had. I knew we were having this podcast. It's in the evening here. So this afternoon, I went out. I made sure I was out and about doing things that I enjoyed, just to bring, I hope, kind of a positive energy to this interaction too, Liana.
Yes, that thoughtful way of making sure that our interactions really are positive, because that goes directly physiologically to both participants. So I'm feeling the positive energy, and that's helping your health and well-being and my health and well-being. So I appreciate that.
That's true. And Liana, to be perfectly honest, the first time we met, I got that buzz of energy just by talking to you. And so and the research, of course, supports this. Positive relationships are great for our well-being. So I guess that's it. It's thinking, how do I want to be for a particular interaction that's coming up? But then I ask myself, what do I need so that I can bring that kind of energy to? And sometimes I'll take a nap in the afternoon if I'm feeling a bit tired. Sometimes I'll listen to really, energizing music. I've got a big speaker here just in this room. So I think I've learned that, especially during the pandemic years, because I'm naturally kind of bubbly and positive, but I didn't feel that way a lot during the pandemic years. And I realized that I hadn't got a menu of things. I hadn't ever needed to think about it that carefully. So I think during the pandemic years, I did develop intentional strategies to say, what can I do to get my energy to where I'd like it to be?
Well, and the list is fairly long, but I love the recent ones you mentioned, naps, beautiful music, time in nature, time in the garden. For me, I'm a very visual person. I love bright colors. I do some art. I wish I had more time to do art, but just even looking at beautiful, bright colors really boosts my energy. So we find different ways to get that sense of vitality that we then bring into our relationships, and it's a win-win all the way around.
You're right.
So I love that. Well, let's move back to the topic. You're a coaching expert. So share with us how, and we have mostly health professionals in the audience that find themselves in one way or another coaching and counseling patients, and a lot of them are counseling around health behaviors and healthy lifestyles. So, and we all know that's so difficult, but as an expert, what are some of the key kernels of how we can make sure that those changes are achieved, sustained, and ongoingly sustainable?
Yeah, what a great question. And I think, yeah, what a wonderful question we're paying attention to now. I love it that we're doing that. I do believe that coaching has a contribution to make for the reason I mentioned earlier, that coaching, all of the attention of coaching psychology in the first 2 decades was really about pinpointing what are the ways to bring about, and in our context, we were talking about desired behavioral change. So what are the ways to bring about desired behavioral change in a way that's sustainable, so that the change is embedded? So because of that focus, I just love the idea that we can bring some of that to conversations about desired health-related, maybe behavior change might be how we would call it. And before I just want to highlight what the evidence is saying about coaching psychology, but just a moment, if I might appreciate the listeners of your podcast. I'm honestly just so grateful that people are showing an interest in this, and I know how much health professionals and others working in this area, care deeply about, outcomes for their clients. So, yeah, thank you to everyone for that. And I've come to this area from education. My research over the last 10 or 15 years has been about how the application of coaching in education can do a few things. How can it empower leaders in educational settings? How can we get better outcomes for students? And how can we support educators to be at their best when working with students? And that's where I'm seeing the possible, parallels here in the health context. So I think we can use coaching directly with clients or patients. We can use coaching approaches when supporting the professional learning and well-being of health professionals, but we can also apply it to leadership approaches and styles. So I'm optimistic that there will be some benefits. There's been a study that literally came out, so I just want to refer to this a couple of days ago. It's a meta-analysis. And this meta-analysis about workplace coaching confirms that workplace coaching is effective. And I just want to share what are the things that coaching can influence. And according to a number of meta-analyses, they can improve well-being. And even if the topic itself is not about well-being, coaching type conversations can have a positive impact on a person's well-being. Coaching's been shown to improve resilience or coping, which obviously is relevant in our context. And it supports goal-directed self-regulation. A 2022 study said that psychologically informed coaching approaches increase goal attainment and self-efficacy. So there's another key thing that I think we're all interested in. And the most rewarding thing for me to see in a study from 2022 is that an integrative coaching approach leads to even better outcomes and supports psychological well-being. So there's a lot of research there to show that it actually does support goal attainment. But if I were to try and present coaching as simply as I can, I think it's a conversational methodology to support people to plan for better futures and then break it into small steps so they can implement it. And it's a methodology that supports people by intentionally not telling them what to do. And I think that's a really powerful part of what coaching is.
Yeah, and that actually leads to the next question. So I do teach a little bit around health behavior change.
Yes.
And in fact, it's part of with the American College of Preventive Medicine, there's a mental and behavioral health section. And one of the key constructs that I try to highlight is in counseling, coaching, nudging, facilitating behavior change, the autonomous decisions of the person you're coaching is really important. So then that leads to that question of, as experts, we have a lot of information to share. We want to nudge our clients, patients in the direction that we think science shows will contribute to their well-being, but we want to preserve that autonomy and independence so that it is authentic and sustainable. So how do we balance that?
What a wonderful question. And I think ever since I joined the Center for Positive Health Sciences, I think it's my second year now, I think that's been our key question, Liana, and we're very grateful that you're supporting us with this thinking, because I really think it's one of these areas where we really want to access expertise from across the board to identify it. But where we are now, we've actually at the center set up a master's in positive health coaching. And that's exactly what we're trying to do, is find a way to balance the things that you talked about. How do we support the autonomy of our clients whilst also sharing evidence-based or research-informed best practices? How do we balance that out? So what we've done is we've taken the traditional form of facilitative coaching or non-directive coaching as really a basis. We think of that as a stance that we take. The stance is we want to facilitate other people to identify the best ways forward for them on the basis that they are experts in their situations, their context, or their strengths. So that's what we're trying to work with. But then at the same time, the question is always, well, what if the health professional has strategies, techniques, ideas about how that can be implemented? So our methodology, we're calling it dialogic coaching. And it's a methodology that I've developed with my good friend and colleague, Dr. Jim Knight, who's based at the University of Kansas. He's based in Kansas. He'd probably want me to tell you he's a Canadian citizen. So he's a Canadian citizen living in Kansas. And the methodology, the dialogic methodology, sets itself between directive and non-directive approaches, or facilitative and directive. And it's dialogic because there is some sharing of information. So we've got a model called positive health coaching that starts. So is it okay just to talk you through what the model might look like?
Sure, please.
So the model, let's imagine there's a health professional, and it's important to imagine there's a client who desires health-related behavior change. So that's what the area we're looking at. That's the group of people we think coaching can support. They already want to make a health-related change. So if it were a positive health coaching conversation, the positive health coach would start by finding out about the person's what's going on for them now. So they would find out a little bit about what's happening, try to understand their attitude to their own well-being. So there would be some questions about that, and we would ask, what attitude do you have in general to your own health and well-being? Then we would move on to a desired outcome of the client. And we're not looking for goals or short-term targets. So it wouldn't be, for example, to lose a certain amount of weight. That would be a target or a goal. The positive health coach is wondering, what is motivating you to want to make this change? So we're trying to connect with the aspiration, the longer term or strategic goal. And in both of these, we take still the facilitative stance. So the positive health coach is listening, appreciating, as we talked about earlier, Liana, building the relationship between the coach and the client. Then we move into what we're calling the pathway stage, where this is where we begin to explore possible ways forward. This is the part where the autonomy versus sharing of expertise comes in. But the way we've designed it, the client would initially share what they've already tried, what they've thought about. You know, in the modern age, many of our clients will have researched things online. They will have asked people. They will have tried things. So we really want to capture this. What have you already tried? What are some of the thoughts you have? And then with permission, the positive health coach adds information to say, well, based on what we know currently, based on science or research or medicine, here's a few other things that you might want to consider as pathways. So that's the pathway stage. Then there's another stage which we think is important, which is for the client to think about their context. So let's say one of the pathways selected was, jogging, daily jogging or something like that. They would think about, is the context conducive to that? Is where they live? Are there places to go running? Are there other people in their community, their family who already run? So we're trying to see how likely is that to be successful. In both of these points, coming back to autonomy, the client selects. The client says, I think I'm going to choose this pathway. And then after assessing the context, we go into a final stage of co-design. And this is where the health professional and the client together design what we're calling an experiment. And we're using that word on purpose so that the client really sees this process as primarily a learning process. We're learning about what's going to be best for working towards their desired outcome. So that's a little snapshot of an initial outline of the model, but it's really a working model. We have some of our postgraduate students using it at the moment. We want to do more research into it. And so we're learning as well.
I like using the term experiment because I think it conveys the idea that you might fail. In fact, you might expect it to fail a few times. Experiments have to be done many times before we find success. And it takes the pressure off of, this is the commitment, this is the action plan, and now we're going to move forward and we're going to be successful. And then someone who's not successful can be deflated and not want to try again. Whereas this opens up the fact that we're human and it's going to be messy, and you keep trying until you find something that works.
Exactly. I love the way you captured that. That's exactly it. And, next time the positive health coach meets the client, that would be the question, is what did you learn? What happened, rather than did you manage to do it or not, which can have this deflationary, I didn't manage to do it. Whereas let's say they were planning to run, 5 days out of 7 and they ran 3 days. We can still celebrate that. So, okay, what we've learned is 3 days a week. What else should we do? How will we refine it? And I love the idea of continual refining, because what we want isn't for somebody to implement something for 1 month diligently and then it drops off. We really want them to find something that fits in, that they're capable of doing, they feel capable of doing, and importantly fits in with their context, so they can decide, yeah, this is manageable. So that's the hope of this. And for me, this is a great example of the integration of coaching and positive psychology, because for me, that integration is about ensuring that the pursuit of goals doesn't actually get in the way of somebody's well-being. We're looking for ways to support people to bring about desired behavioral change in a way that's actually enhancing their well-being.
Yeah, it makes total sense. And you really are focusing on this interaction and relationship between the coach and the client and the patient. And I know there's this construct that you're working on about better conversations. So is that what you mean? Or is there more to better conversations?
I think the term better conversations is one coined by Jim Knight, who I mentioned earlier, that he's got a great book on the topic, better conversations. But I think if health professionals are asking, well, what's going to be different if we do implement coaching in our health context? I think that would be my first answer. My first answer is really the first thing we're hoping for is better conversations. And the better conversations, we argue, would lead to better outcomes and better well-being. So that's the reason for it. And I like the broadening it out to better conversations because, you know, in many health contexts, the idea of people sitting down, spending half an hour together, you know, one-to-one, may not be feasible. I hope it is possible in many contexts, but I think there's something about health professionals adopting a coaching approach in their interactions with one another, or leaders adopting a coaching approach. So when I talk about better conversations, I'm just thinking about better conversations throughout a health setting that lead to better outcomes for the client, or, you know, the end user, whoever it is we're thinking about. And that's what excites me about this. And really, what this then raises for me, Liana, I feel I'm talking a lot. Is this okay?
This is great. Finish that thought.
Okay, sorry about this, but I get really passionate about this. But what it leads to is what we were talking about right at the beginning. Is then it makes us ask the question: what do our health professionals need in order to be able to have these kinds of conversations? And of course, the question of what about their well-being? How well are they? And how can they be in a position to have these kinds of conversations, which I think is another parallel important question. We're focusing on the coaching component, but I do think that's another important question that it raises.
It's amazing that you bring that up, because now it gives me all kinds of ideas of how we should. There's so much that we put together that's informational and education and training for our health professionals about working with their patients. And then separately, we talk about, well, we certainly know there's burnout and clinician distress and many other problems with our health professionals, and we need to be supporting their well-being. And certainly that's the case. But what you're bringing together and bringing forth in this question is that is so absolutely necessary, perhaps, to have not perhaps, but absolutely to have an effective relationship and interaction with the patients. And so then that's all part of the whole model. You can't just embark on coaching and counseling without first maybe putting on your own oxygen mask and figuring out what you need in order to connect effectively.
Absolutely. Absolutely. That's really at the heart of it. And I think that, our efforts towards that are so valuable. And I have worked with organizations in different parts of the world in a consultative capacity. And I do remember a little bit of pushback about some of these things, because I was saying, in educational contexts, I was saying, look, if your staff feel valued, they feel listened to, they're thriving and they're experiencing well-being, I said they're more likely to provide the kind of service you're hoping, etc. And sometimes there was a bit of pushback to say, oh, but are you sure that will lead to, the better outcomes? And I kind of, I struggle with that, because for me, it's a good end in itself. If it didn't lead to anything else, I think the idea of looking after our people so that they're better able to look after others, but that's good in itself. So this is why I do think there's some mileage in this. And, coach training people to be coaches. In the education literature, it's been suggested that if you train a professional to be a coach, they become better at their substantive role, whether they're an educator or a leader. It makes sense to me, because the coach skills training is all about listening better, asking better questions, being fully present, being attentive. So these are skills that, our best health professionals already have. They bring those skills. And if I might say something about burnout, again, I'm seeing parallels here, because our best educators care so deeply about, those outcomes for students and young people. the risk of burnout, I would say, may be higher. And of course, I think that applies in the health context, where people are here because they want to help people be better, they want to cure people. So I think we need to be cognizant of the higher risk of burnout, and therefore, what can we do to ensure that they're at their best?
Yes,
and that's
yes.
good enough, but also so that they can be of better service to others.
Yes. Well, wonderful. Well, there's just so much more to talk about, but we're running short on time as we try to keep these podcasts brief. So for our listeners who would like to learn more about what we've been talking about, what are some resources you suggest?
Well, the book, I don't want to seem like I'm promoting the book, but I think it's a good book. From Surviving to Thriving actually captures a lot of positive psychology strategies that are useful for anyone. It's written for university students, but I think it would apply to anyone. If you have a look at our Center for Positive Health Sciences website, RCSI, University of Medicine and Health Sciences, we have some free courses there. You can learn a little bit more about what we're doing there. So I would invite you to do that. And in general, I think podcasts like this, Liana, thank you so much for hosting these. I know it takes a lot of time and thinking, so thank you for hosting. I love these as an opportunity for us to share ideas. And I just want to say, I'm so grateful for you inviting me, Liana. My expertise is pretty narrow. It's around coaching, and I hope some of the ideas I've shared have been helpful. And I'm really looking forward to more dialogue, more collaboration, because we're all passionate, I think, about trying to get better outcomes right across the board.
Yes, we have the like-minded passion, and we're approaching the end goal from different perspectives, different models, different approaches, and together we'll come up with a center truth, something that really will be effective for all of us, not only in medicine, healthcare, lifestyle medicine, which is our community, but you're working more broadly within educational centers, human resources centers, et cetera. And so these have broad applications. So thank you for being our guest. And before we close, are there any parting words, any single most important thought you would like to leave with our listeners?
I took the opportunity to mention before, but it's a genuine sense of gratitude for the work that you do. The kind of work that Liana and myself and others are doing is really about supporting you to do the amazing work that you do. And I'm just so grateful for your interest in this topic. So thank you so much.
Thank you. And so that was and is Christian van Nieuwerburgh, and we will have more wonderful guests coming up. So thank you to our listeners. Please join us for future podcasts, and please subscribe to our GPHI YouTube channel. Until next time, take care, be safe, be happy. Bye-bye.